Neers Test is a physical exam maneuver used to diagnose shoulder impingement syndrome. Shoulder impingement syndrome is a common condition that occurs when the tendons of the rotator cuff muscles become compressed and irritated as they pass through a narrow space between the bones and soft tissues of the shoulder joint. This can result in pain and weakness in the shoulder, limiting movement and function. Neers Test is a simple and reliable diagnostic tool that a healthcare provider can perform in a clinical setting. It is often used with other physical exam maneuvers and imaging studies, such as X-rays or MRI scans, to confirm a diagnosis of shoulder impingement syndrome and guide appropriate treatment. To use our free Neers Test, follow these steps. Download our Neers Test from the Carepatron platform, which you can find in the link in the description. Firstly, position the patient. Ask the patient to stand or sit upright with the arm to be tested at their side. Stabilization. With one hand, stabilize the patient's scapula to prevent movement during the test. Next is arm flexion. With the other hand, flex the patient's arm forward and upwards, raising it as high as possible. Next is the test result. Observe the patient's response to the maneuver. If the patient reports pain or discomfort, note this on the template. Repeat on the other side. Perform the test on the other shoulder if necessary and document the results. Diagnosis. Use the results of the Neers Test, other physical exam maneuvers, and imaging studies to confirm a diagnosis of shoulder impingement syndrome if present. Treatment plan. Develop an appropriate treatment plan based on the patient's diagnosis and symptoms. Neers scoring system is used to quantify the severity of shoulder impingement syndrome based on the patient's response to Neers Test. The scoring system assigns points for pain and weakness during the test. The higher the score, it indicates more severe impingement. The scoring system consists of 4 categories, each with maximum possible score of 3 points. The first one is pain during forward flexion, the next one is pain during forced elevation, the one after is weakness during abduction, and lastly night pain. The total score is calculated by adding the points from each category with a maximum possible score of 12. Here is a sample of our Neers Test, which you can find on our Carepatron platform. To find our Neers Test, go to our Carepatron platform or click on the link in the description. In our template section, we have a variety of templates and worksheets for you to use with your patients. You can filter or type in the keywords to find the worksheet. Thank you for watching our video at Carepatron. If you enjoyed this video, give us a like. If you would like to see more videos like these, subscribe to our Carepatron channel or click on one of our recommended videos.